Dr. Childs-Roshak, thank you so much for joining the Jane Fund. We wish we could host you in person at our annual meeting, but failing that, we're really glad to have the opportunity to learn more about your work in the past year in general and going forward. So it feels very 2020, 2021 to start with misinformation, which I think is on all of our minds. But we wanted to ask, what misconceptions about abortion do you encounter among people who would call themselves pro-choice?
Yeah, thank you. And thank you, Liz, so much for the opportunity to speak with you and to speak with the greater membership. And before we launch into the interview, I just wanted to express my sincerest thanks for the work that the Jane Fund does. I think today we'll probably touch on how important it is more than ever, especially with more rights being either improved at the state level or taken away at the state level, that justice funds and organizations like the Jane Fund are so critically important. So thank you, and to all your members for the work that you do. More important than ever, even in 2020 and 21.
For sure.
So thank you for asking this question about misconceptions, because I do think it's one of those really interesting things that people don't think about, and it just, I think, is a testimony to how much we all are subjected to or are influenced by unconscious bias, right? So I think there's a couple of, and I'll start with some top line answers and then maybe add in a little detail. But I think the first misconception is that people have is that if something's legal, then everyone has access, and that's not the case, and we'll talk about that in a second. I think the other misconception is that blue states, everything's fine. And I'll circle back to that in a second as well. I think, a third misconception is, and even for people who are very much about, pro-choice, talk about being supportive of abortion rights, there is still a tendency to think about, and I'm using air quotes, good versus bad. So there's sort of this moral overlay around what are the good decisions or the bad decisions connected to abortion care, and people deciding to have an abortion as opposed to not. And then I think the last misconception is that abortion is somehow different. It's often, and this is where you see this bias in the advocacy work that we do, but even in things like how we get paid for abortion care versus non-abortion care, it is definitely considered sort of an other health service, and it's not. Abortion care is healthcare, and it's just as important as someone getting good diabetic care or having treatment for cancer, and you can talk about the people's personal feelings. But at the end of the day, abortion care is healthcare. So I think, the one thing I would just circle back to is just that concept of things being, if it's legal, then everything's fine. If you're in a blue state, no worries. And I think what we have definitely seen even here in Massachusetts, that, just because something is legal doesn't mean that everybody has access. And having access is complicated, but it is really important. So I think those are probably the big things that I hear, in Massachusetts in particular.
Thank you. Yeah, I always say that if abortion were accessible, the Jane Fund wouldn't exist. And as proud as we all are of the work that we and our supporters do, the Jane Fund shouldn't have to exist. No abortion fund should have to exist. It should just be accessible. So thank you for all of those points. On a really positive note, most of what was in the Roe Act has passed into law thanks to the hard work of many, many folks, you included. What do you think this victory can teach us about Massachusetts and more broadly about organizing around reproductive rights?
Yeah, and thank you. This was really an amazing couple of years, right? Because the legislative session started a couple of years ago. And I think the thing that is really important to highlight is this was definitely it takes a village endeavor, right? There were over 70 organizations that signed on to the Roe Coalition, and it truly was a broad coalition. Everything from social justice groups to educators to labor unions. It was really to progressive organizations, women's rights organizations, reproductive rights organizations. So, I think it was a great example of how important sexual and reproductive health care is to everybody's life, and how it really impacts everything that we think about in terms of having a healthy life. And it's not, again, as I mentioned a little earlier, it's not this separate thing. It actually is who we all are, and it impacts families and communities in really profound ways. So, really excited. I think one of the things that I'm most excited about is, and a lot of folks may not be aware, that the laws that were on the books in Massachusetts that were overturned with the amendments, the Roe amendments, were put on the books in 1974 as a specific reaction to Roe v. Wade. There were some very angry, far-right folks at the time. And it's interesting because I don't like to talk about Republican versus Democrat, because there are a lot of Republicans that respect individual autonomy about making choices about healthcare and about abortion rights. And there are Democrats who don't feel the same way. So, but I think, in 1974, there was a group of folks who said, we don't agree with Roe v. Wade. We don't agree with access to abortion care. So we're going to make it as hard as possible. And so I think, the other couple of takeaways from this last few months has been, a real interest in people looking at history and saying, it's time to modernize. It's time to make some of these things fit with our current culture and our current situations and our current decisions. And I think a great example of that, is the telehealth portion of parental consent. So, for folks 16 and 17, they no longer have to seek out a parent's permission to access abortion care. And for folks under 16, so 15 and under, they do still need to either have a parent consent to abortion care, and that's 75% of young people do that, or if they can't, then the judicial bypass process can be over the internet, which is a really important modernization. That especially during the pandemic, I think that made it clear that was important, but I think that's really important going forward as well. Reduces the time away from school, the time looking, to getting to appointments, the stigma, all of that. So I think those are really important things. And then the last thing I would just say is that, I think this really helps solidify the fact that, sexual and reproductive health and rights for all and access to health care, not just the law, but the access to health care, is a winning issue. It is something that people really support in our Commonwealth. In fact, over 70%, almost 75% believe that Massachusetts voters support abortion rights. And that's on all fronts, Republican, Democrat, and Independent. So, I think that this achievement around the Roe amendments really underscores that. If folks were at all concerned about talking about sexual and reproductive health as being somehow, not politically okay, I think this helps dissuade that false notion. So really excited about that, and I hope that leads to more frank conversations about what's really important to people.
Me too. That's wonderful. So from that high to this low, how do you envision a future if we lose Roe v. Wade? And I ask that with two audiences in mind that the Jane Fund speaks to a lot. One is folks who remember what things were like before that ruling. And then those of us who weren't alive for it and maybe don't know how that felt.
Yeah, and it is really important to remember the history, remember how did we get here, and to honor, those people who fought so hard, and for women who gave their lives trying to make personal choice about personal autonomy. Those stories are so critically important to remember and to hold in our hearts as we continue to fight for the future and to continue to improve things. So, I think I actually always like this question because I think it's really important to say as often as possible, we don't have to imagine what would happen. We saw what happens, and we saw a glimpse of the pre-Roe v. Wade before the 1973. We saw what happened in Texas just a handful of years ago when there was a case that ended up making its way to the Supreme Court, but Whole Women's Health was shut down, and they were an abortion provider in Texas. And the Whole Women's Health versus Hallerstadt case, really essentially almost all the abortion providers in Texas, because of targeted restrictions on abortion provider or trap laws were put into place, actually, shut down the majority of abortion providers in Texas. And, by shutting down the abortion providers in places like Planned Parenthood, they also reduced access to birth control. And what we saw was exactly what would happen in the future, which was that women started Googling how to do my own abortion. They started showing up in emergency rooms with complications from back alley or their own attempted abortion care. And we know that was dangerous for people. And so, so we don't have to imagine far. Luckily, that case did make it to the Supreme Court, and it came down in favor of Whole Women's Health, and access was opened up again. But, great example. That was not overturning Roe v. Wade. That was focusing on ways to reduce access to abortion care. And I think the other thing, again, it's, the future is here, right? Is you look at, and this is where I say always, I am so glad to be in Massachusetts. But, there are states across the country, many of whom, and there are, dozens of cases that are working their way through state legislatures where abortion access has been, nipped away at the states. And so, that is increasingly protecting access is really increasingly left up to the states. Even with Roe v. Wade in place, there is some really significant barriers to accessing care. And again, as you mentioned, that's why the Jane Fund and the other access funds around the country are so critically important, because we know that, reducing access, banning abortion, overturning Roe v. Wade, it will not change people's desire to make their own decisions. And it just makes things unsafe and frankly deadly. And that's really what the future holds. And it is hard, when you talk about for folks who haven't grown up in that environment. I do like to point people towards what's happening now and what happened in Texas. It doesn't have to happen to you exactly to have at least some understanding of it can happen again. It's not just something that went away in 1973.
For sure. Thank you for that nuanced take, and hearing your description of the danger that people would face from, hearing that from a physician is really powerful. And as the Jane Fund knows, as you know, many, many people across the country are already in these circumstances because of, like you said, trap laws and minimized access. So those folks call us and we're able to help.
Absolutely.
Just a few of them. Yeah. I'm curious to hear how the pandemic has affected abortion and reproductive health care this past year during COVID, and if any of the changes that have been made are likely to persist after the pandemic dies down.
Yeah, thank you. One of my personal favorite things is telehealth. And, I've said this before, but maybe not to your audience. There were two big things that my patients used to say to me. So I was practicing up until the time I took the helm here at PPLM. But, two things. One is, how come I can't get 12 months of birth control pills at a time? And the access bill a couple years ago solved that problem. And then the second question people would always ask is, how come I can't do a Zoom visit? Well, then it wasn't Zoom, but a Skype visit and meet, over the internet. And I would share their frustration with that. And so telehealth has been a really top of my priorities for the last 5 years. So I would say that and the health law that was just passed by the legislature less than 2 weeks ago included coverage for telehealth beyond the pandemic. So, would say that, there have been not a lot of silver linings, obviously, for a pandemic that's killed, over 400,000 people in the country. But one of the things has been, I think, an acceptance and it actually embracing telehealth. And it's something that I think patients have wanted for a long time. And it is something that we have seen at Planned Parenthood League of Mass, has really enabled us to stay connected to patients and to be there for them when they need care, how they want the care, even in the midst of a pandemic when it's impossible for them to leave home, or they've lost their job and now they don't have health insurance. And so lots of ways to connect with patients, and the gratitude we have felt from patients. It's not just getting the care, but it's being that caring voice at the other end of the phone, who's able to work with them, answer their questions, allay their fears a little bit. And so that's something that has been super helpful to us, to be able to deliver essential care and continue to deliver essential care. We're still doing it. And we still have a lot of, obviously COVID is raging still. But it is definitely something that will live beyond, sexual and reproductive health care, which is great. I think for patients in general, I think that's a really big thing. I think the other thing that will persist and, kind of the impact of the pandemic, we saw this with the recession, several years ago too, is that, hard times really do impact people on their decision making about starting a family, when to start a family, if to start a family, how many children to have as part of their family. And we know that from the Guttmacher Institute that COVID has been the same. And so, I do think that, the importance of education, the importance of knowing what your options are, the importance of understanding birth control options and accessibility, all of those things have been really important because that creates a sense of autonomy for folks. And agency to be able to say, okay, at least I can understand, some of my reproductive health options, even during difficult times. So I think that's really important. On the not so great side, what we have seen in the pandemic, and we referenced this a little bit earlier, but other states have used the pandemic as an excuse to restrict services even more. Again, so grateful to be in Massachusetts where sexual and reproductive health care and abortion care has been considered an essential health care. And so we have been able to stay open and provide care. But other states, folks have not been so fortunate. And obviously, abortion care in particular, is very timely. And so really important that people have access to care. And that's sort of the bad side of what we've seen happen with the pandemic.
Yeah. Thank you. So I'm wondering if you can tell us more on the clinical side of things about Planned Parenthood's relatively new offerings for gender confirming healthcare, which is an update we were really excited to see.
Yeah, I'm super excited about this too, because, having taken care of patients for so many years, it's just so important to have services for people that are non-stigmatizing, easy to access, supportive, and connect people into whatever services they may need. I think, that is, we started in 2018, started offering gender affirming hormone therapy at all of our health centers, and we started, with one or two, and then now it's available through all of our health centers. And it's actually one of the services that we've been able to continue to provide through telehealth. And I actually think that the gender affirming hormone therapy may continue to stay strong, even as a telehealth service, even after people can come back to the health center more freely, because I think it's something that people really appreciate, being able to have the service in the comfort of their own environment, whether it's home or not. We know from a lot of research that transgender folks have traditionally had very negative experiences with healthcare providers. And so I think there's two parts of that. One is then I think telehealth provides that more comforting experience for folks. And then in the health center, we did spend, as part of our initiation of services for patients, we spent some time with an advisory group, really understanding how to be as inclusive as possible. I'm sure there's always ways that we can continue to improve, but thinking about, everything from the beginning of the visit on the phone call to leaving the visit, thinking about things like how do we ask people about their preferred names, their pronouns, where is that represented in the medical chart, on the non-medical information that patients get. How are we using, what's the language that we're using? What about bathroom access? Do we have gendered or non-gendered bathrooms? So we, and then also training our staff. Again, we talked earlier about unconscious bias and just lack of understanding. And so a big part of our service for patients has been making sure that all of us in the organization, especially the frontline staff taking care of patients and clinicians, really have a better understanding about being as inclusive and welcoming as possible. And so, I think those are all elements to the service that I think are really critical, and I'm really proud of. It's in some ways, very easy to write a prescription for medication. But what's much more important than that is all of the decision making and the support, and really truly caring for patients. And that's what I'm really excited about with the services that we've been providing and offering some choices for folks. I think the one last thing I would just mention, I often forget this because it seems a little, just so out there that, there are a number of programs and practices that require transgender patients to jump through certain hoops, and one of those hoops is a psychological assessment. We have felt, and there's lots of clinical research that supports the fact that is stigmatizing, and that does provide a barrier to care, and it doesn't actually improve the outcomes for patients, or really impact what they're, how they're feeling and who they are. And so one of the important parts of the service, as we decided to offer it, was not requiring any pre-screening process about, psychological testing, et cetera. And, I think that's very much in line with our vision and philosophy in general, which is trusting patients to make their own informed decisions about their own bodies and about their own healthcare. And so I'm just really excited that fits in, very much with our overall mission and how we really care for people.
That is, beautiful work, beautifully done. And, it ties in with all of your previous responses about personal autonomy. That's awesome. So that's one intersecting issue, which, you can talk about more, of course, but are there others that you see affecting your patients, which is another kind of way of asking, where else can Jane Fund supporters focus their efforts or direct their attention?
Yeah, that's a great question. I think as a family doctor, I have, I guess, and I don't know, maybe it's being the oldest of 5 kids, growing up in a small community where everyone had to kind of chip in. I don't know why, but I have always really seen the connections between healthcare and health, because they're not the same thing. And healthcare is a subset of, and it can contribute to being, having good health, but there's so many other things that contribute to good health and health in general. And I think that's where that intersection is really important. So, one of the examples I like to give, just because it's easy to understand, is, if I have a patient who's a diabetic and we have a conversation about the things that will help them control their diabetes and reduce their blood sugar, and reduce their complications. And it includes things like a healthy diet full of vegetables and exercise, like walking around the neighborhood. And they live in a dangerous neighborhood where they can't go out for a walk, or they don't have a store where they can get fresh fruits and vegetables. Everything's packaged and double the price. Those things really impact their ability to leverage the healthcare that they're seeking and to achieve good health. And so, things like that are so important, systemic racism, income inequality, housing instability, having a job or not having a job that has health insurance, or even, I'm so proud of the state for finally having a paid leave policy. If you're going to get fired after you have a baby because you don't come right back to work, it's those things that really impact people's health. And it's not just their individual health, but it's the health of their family, the health of their community. And then, that's all of us. And so I think, you can start to get a little overwhelmed thinking like, oh, there are so many intersections. How can we solve everything? And we can't solve everything, but I think we have to lean into some of those underpinnings of our society, like systemic racism, and then that tends to kind of lead to a whole bunch of things, like inequality around education and income. Those things really, they really do impact everybody, in various ways and get in the way, of good health. So I think, the bottom line for us is at Planned Parenthood is, we truly believe that sexual and reproductive health care and good health, is a doorway to good health in general. But we also, believe that we need to be part of, and we all need to be part, including, I think the Jane Fund, should take the pat on the back, that what you are doing is by creating the economic ability for people to reach, their healthcare decisions. That is really important work. And it's, you're already doing some of that intersectional work by thinking about, where are the gaps in access, geographic, financial, et cetera. So I guess I would just say, for us, when we start to take a step back and realize, what are the bigger things that really do get in the way of good health in general, that's really what we're after.
Yeah. That feels like a timely message for the start of the new year too.
I think it does. And to be honest, I think the other piece of the pandemic that has, I think really helped, I think in some ways it's really helped people understand a little bit more, how healthcare in general is inequitably, unevenly distributed. And I think, the underpinning of systemic racism impacting healthcare has been pretty easy to understand. And I hope that translates into people really going deeper and understanding, what is it that what actions do we need to take? It's not just enough to write a check. What are the other things that we need to do to really start to dismantle that system that impacts so many people?
For sure. Thank you so much for your time, your leadership, and the really compassionate, respectful care that we know that the people who call us will receive in your clinics.
Thank you so much for having me.
You're welcome. We're really proud to work with Planned Parenthood. So thank you again. And we wish you health and all the best in the new year.
Thank you. And to you and all the Jane Fund folks. And again, I just want to express our gratitude for working with all of you. I think, but, we hear the stories from patients and the relief in their voices when they talk to someone from the Jane Fund, and they know that they're going to be okay. And that work is just so important. And we appreciate all of you. We appreciate the work that you do. And I know for sure that our patients do as well. So thank you, and be safe and be well.
We feel really good that we have managed to make the adjustment to keep our patients safe as well as our staff, because we're one-on-one, we're up front all the time. We happen to have clinic 4 days a week. We see patients from 5.5 to 21 weeks and 6 days. At one time it was 24 weeks, but due to the legislation, we had to more or less cut back. And so we are still seeing patients 21 to 6 weeks. And as I mentioned, we see patients from Tennessee, Alabama, Kentucky. Oftentimes we see patients from Ohio, Louisiana, because of their cutoff. And like I said, we're still pretty up there with the 21-6 compared to some other states. I also wanted to say that we see about 400 and 500 people a month. When I say people, I'm including partners too, because they're part of it. And right now it's real tough because they can't come into the clinic with a patient due to the COVID distancing required. But they're able to bring in their cell phones, and we try to keep them abreast of what's going on inside. If they're able, they can go outside and sit with whoever drove them to kind of keep that connection going and to feel like they were actually there for them to do that. We have a diverse group of women. We see women from 12 years old to 54 years old. So, and that's pretty much, the active period of reproduction anyway, but some circumstances are preventable and some aren't. So we don't judge, we just help where we can. We couldn't get it done without funding services because a lot of our women come from low-income families. They depend on Medicare, Medicaid. Oftentimes, they have several children, and now that the kids are home from school, they're not working. And what do you do when you have nothing to do? So they can't afford another kid, but yeah, it still happens. And so we're here. Regardless, and we enjoy what we do. Everybody's passionate about what we do. We're tired at the end of the day, very much so. But for some reason, everybody keeps coming back, including me. But I just wanted to say thank you. I really appreciate the honor, and love you guys, and our patients do too. And thank you so very much.
Hi, I'm Vicki Angelico, the incoming president of the Jane Fund. You're about to hear from Marisa Pizii, an abortion storyteller with We Testify. We Testify is an organization dedicated to the leadership and representation of people who have had abortions. You can learn more at wetestify.org. Marisa Pizii is the Deputy Director of Programs for Civil Liberties and Public Policies, or CLIP. Prior to CLIP, Marisa co-directed the Prison Birth Project and Mothers of Color Awareness Initiative. She also co-organizes an abortion doula collective. In 2010, Marisa elected to have an abortion at 20 weeks, 3 days after her 20-week ultrasound showed lethal fetal abnormalities. Marisa was already a mother to one young child, and as you'll hear, centers her identity as a mother within the context of her abortion. Now, here's Marisa. So I am here with Marisa Pizii. She is an abortion storyteller with the We Testify network. Marisa, thank you for being here today, and thank you for sharing your story.
Absolutely. I'm really happy to be here and share with you all. So I always like to tell my story actually not from the point of my abortion, but from the point of entering into motherhood, because my abortion is such a large reflection of my motherhood, that's where I start. So my motherhood story started in 2008 when I gave birth to my first child on Mother's Day. And I always felt like that meant like some special little relationship piece between him and I. And so when I entered into my second pregnancy on the cycle that started on Mother's Day, I was pretty sure that fate was realigning with me and telling me that I could still move forward and that all my motherhood was going to be sweetly tied up into this beautiful bow of Mother's Day. However, at the 20-week scan, it was very clear very quickly that that was actually the furthest thing from the truth. And after about 2 weeks of intense and overwhelming doctor's appointments where I was traumatized left and right by the medical system, it was clear to me after the MRI that I had that my second child didn't have any lungs. And so it became a choice of moral safety for him, a choice of parenting, and a choice of love to decide to terminate and to go through the process of termination. And what's also really important and why my motherhood is so tied up in my abortion story is my first child was born through a cesarean section. And so this child, this second child of mine, was going to be my liberation back into a vaginal birth. I didn't want to be pinned down into having the cesarean section every time I had a child, which my plan at that point, upon entering into motherhood, was to have at least 4 children. And so he was my VBAC baby. And that was a really critical component that I maintained and didn't refuse to let go of throughout my abortion story with him. And so I had to go through the process of doing a very clear, like, action steps into terminating him, and had to have what was the equivalent of an amnio. I'm not even going to try to say that word because clearly it's not going to come out. An amnio to stop his heart and then proceed to give birth to him. And so I was able to do that. And I share that piece with people often because I think it reminds folk that an abortion is not this impersonal experience that happens to people where you go behind this wall of curtain and you come out without a pregnancy. It's an active, involved procedure with patient and doctor. And it's a part of how we move forward and a part of our fabric and thread of our story. And so for me, it was yet another expression of my motherhood, and that I was able to give him as much as I could. And I always like the name that I gendered all of my children and definitely operate with a parenting model of, until they have told me differently, I am going to operate with the gender that I understand them to be based on the societal norms of sex and gender being so tied together. So anyway, to like be the mother for him meant that I gave birth to him. It meant that I met him. It meant that I held him. And it meant that I touched him and told him how much I loved him. And so I just think that that's a really important piece and has helped me really understand that my abortion is a reflection of my motherhood.
Thank you for sharing that. How do you think your one experience, your one abortion, how do you think that fits into kind of the bigger, greater quest for access and reproductive rights and reproductive justice?
That's a really great question. And it's something that I do a lot of support work with people who have terminated their pregnancies. I co-organize an abortion doula collective. I work with an organization called Empty Arms to support people who've experienced pregnancy and infant loss. And, you know, one of the things that we're really clear on is that the meaning making that we do as people who have lost a pregnancy and or lost it through an abortion path is that it's something that's so intimate and personal that we would never want anyone to make for us. And so I really appreciate this question, because the meaning making I've been able to do around this experience is that I've come to understand how much of the political narrative was a part of my narrative before I felt the liberation that I feel now in my body and in my soul around being really clear that my abortion is a part of my lived experience, and it's part of the legacy of the lived experience of all of the women before me. And so I understand that it's a political stigma, it's a political choice because it's been politicized. It was never any of that in the moment. It was always in the background, talking, saying. So like things like the doctor said, you know, I would be remiss if I didn't tell you, you have until 23 weeks and 6 days to make this decision. It's things like that. It's that little yammering in the back that was clearly all about the politics. And so in writing my statement and in speaking to my statement in many ways, I really have learned that it's not really a moral conversation that the politicization would have us believe. It's a moral conversation within. It's a moral understanding of who you are as a person and how you want to create or not create harm. And it's not about whether or not I'm a good person or a bad person for making the choice to have an abortion. That is the political stigma. And so I definitely understand that I am one of many who have made this choice for more reasons than we could ever name in 2 minutes, right? Like all the way back to the legacy of Black and brown women who are making this choice to feel the bodily autonomy from being raped, right? All the way up to people who are making this choice because it's an economic decision. Even if they want the pregnancy, it's an economic decision. There's so many reasons, there's so many ways that we come to this choice, and none of it is intentionally a political reason. It's a political reason because we're forced into it, but not intentionally a political reason. And so that's where I've been able to really come to and understand and therefore fight and move towards. And so I really often push people to not hear my story as a good abortion story, but to hear my story as an abortion story. There's no good or bad abortion story. Everyone has their reasons, and they're for them to know and for none of us to have any access to. Access stops at whether or not we can receive the medical care that we need. And that's as far as access goes. So I've really embraced and understand that my abortion is the most reproductive justice thing that I can speak to in my own lived experience. It really truly is a reflection of my bodily autonomy, my right to have children, my right to continue to parent them in health and safety environments, right? Like all of those things is tied up in that abortion. And so when we can stay in that framework, when we can be in the RJ framework, then all the other crap just fades away. And what's left is people's right to their own bodies. And that's what takes precedent over anything else. And so, yeah, that's, I think, the most important thing I've come to learn about my lived experience.
Great, thank you. Thank you so much for sharing your story and for putting it in kind of a little bit of context for our viewers. Thank you for watching. Again, I'm Vicki Angelico, incoming president of the Jane Fund. We hope you enjoyed our inaugural virtual annual meeting. 2020 presented challenges unlike anything we could have imagined, and we miss being able to see you in person. This presentation and the annual report you received in the mail is definitely no substitute for speaking with you and thanking you directly. Regardless, I'll try. Thank you so much for your support this past year. Because of your generosity, we've been able to continue our mission to fund abortions for people in Central Massachusetts and beyond. We are particularly proud that we have expanded our birth control coverage in partnership with Planned Parenthood and of our large donation to the National Network of Abortion Funds Collective Power Fund. We could not have done either without your incredible financial support. Thank you so much. Additionally, I want to thank Dr. Jennifer Childs-Roshak of Planned Parenthood, Marisa Pizii, abortion storyteller, and this year's Judith Fleming Henshaw Award recipient, Brenda J. Carter from Summit Medical Center in Atlanta. Tremendous thanks also to the rest of the Jane Fund board, especially Liz Goodfellow, outgoing president, who will thankfully stay on as vice president. An additional thank you to Hardeep Sidhu for technical support. Again, thank you for watching and supporting the Jane Fund. We'd love to hear what you thought about this presentation. If you're interested in other ways to get involved, or if you'd like to make a donation, including a recurring monthly donation, please visit janefund.org. And here's to a better 2021.